Here's a Puerto Rico medical revalidation style question related to a patient with head trauma, non-healing ulcer, and diabetes-related vascular insufficiency. Question: a 65-year-old male with a history of diabetes and vascular insufficiency presents with head trauma after a fall in the sauna. He also has a non-healing ulcer on his foot, which has been present for several weeks. The ulcer is surrounded by erythema with yellowish discharge and a foul odor. Gram stain of the wound culture reveals gram-positive cocci in clusters and gram-negative rods. Which of the following is the most likely infectious agent in this patient? A. Pseudomonas aeruginosa. B. Methicillin-resistant Staphylococcus aureus, A. C. Escherichia coli. D. Clostridium perfringens. Correct answer: B. Methicillin-resistant Staphylococcus aureus. Explanation: this patient with diabetes and vascular insufficiency is at high risk for chronic, non-healing ulcers. Mrsa is a common cause of skin and soft tissue infections in diabetic foot ulcers, especially when there is poor circulation and impaired healing. The gram-positive cocci and clusters seen in the culture are characteristic of Staphylococcus aureus, and its methicillin resistance should be considered, particularly in diabetic patients. Pseudomonas aeruginosa, answer A, can also cause infections in moist environments like ulcers and burns, but MRSA is more common in diabetic ulcers. The head trauma does not necessarily influence the wound infection directly, but may have led to further compromised circulation, making the ulcer more prone to infection. Management includes appropriate wound care, antibiotic therapy targeting MRSA, e.g. vancomycin, linezolid, and optimizing glycemic control to improve wound healing. Here's a